Meg, my name's Katie. I'm your CNA for today. I'm here to do some vital signs. Is that okay?
Sure.
Great. Just going to wash my hands. Is it okay if I check your ID?
Sure.
Perfect. You are Meg. I'm just going to pull your privacy curtain. Gather my form. So I'm just going to go ahead and start with your vital signs.
Okay.
Just going to raise your bed first, okay?
Sure.
Now, when we go to measure and record somebody's respirations, it's important that we do not tell them that we are going to be doing their respirations. Reason being is it will not give us a consistent view of what their actual respirations are. When we tell somebody that we're watching their breathing, it's going to change how they breathe. If you think about when you've been to the doctor before maybe, and they put the stethoscope on your back or your chest, and they tell you to take a few deep breaths, and they tell you to breathe normally. What do? Some people stop breathing, they're paying attention to how they breathe, and they start breathing quickly or slower. So we want to get an accurate depiction of how they're actually breathing. That's why we're not going to tell them we're doing respirations, and why in the entry protocol I said we're here to do vital signs. So while we're doing respirations, it's important to note that we're going to pretend like we're taking their pulse so they don't realize we're just standing there and staring at them. All right, that's why we're also going to be pretending to take their pulse. The normal respirations for adult is anywhere from 12 to 20 respirations per minute. Just like pulse, we're going to be measuring and recording the respirations for 60 seconds, 1 full minute. 1 inhale and 1 exhale equals 1 respiration. So once again, breathing in and out equals 1 respiration. So there's a few different ways that we can do this. One, for this skill, it is okay to uncover to be able to see their breathing. Once again, we want to make sure that we have a finger on their wrist as if we're doing pulse while we're watching them breathe. So where I always tell people to look in the easiest way is in our upper abdomen here is where our diaphragm lays. Our diaphragm is the muscle that we use to breathe. So every time we breathe in and out, it expands and contracts. All right, so it gets bigger and then smaller. And so our upper abdomen and chest area move. That's sort of the easiest way to tell when somebody's breathing in and out and for us to count the respirations. So we can measure here while we're watching the abdomen rise and fall. Now, if we're unable to see because they're breathing shallow, we can lift their arm, place it across their upper abdomen, and we can then feel as her diaphragm pushes in and out against her arm. Remember, we're keeping our fingers here on the wrist as if we're counting pulse to get an accurate measurement of her respirations. Every time she breathes in and out, her diaphragm's pushing against her arm, and it's easier for me to feel. Either of those would be okay on the state exam and in real life. Typically in real life, what we're going to do is I would record her pulse and then move on to her respirations without her even knowing. Just like pulse, I'm going to make sure that I let the nurse evaluator know when I'm starting and when I'm stopping, or you can let them know what, on the clock, what second hand you're going to start on, so they are counting the same exact time you are. For the state exam, you have to be within 2 respirations per minute or breaths per minute of the nurse evaluator. For example, if you were to get 16 and they were going to get 18, you'd pass because that would be within 2. However, if you got 15 and they got 18, you would fail because that would not be within 2. Thank you. Now, if the patient sneezes during this, you will have to start over. One little tip for you. Thank you. We're all set with your vital signs, Meg. Remember, after we're finished measuring our vital signs, it's important we always have to document it. So if we don't document it, it never happened, and then the nurse evaluator of the state exam has nothing to compare it to. Even if you verbally tell them, they have to have documentation of it. So when we're finished, we're going to document our respiration, so how many breaths per minute we got, and hand it to the nurse evaluator and finish with our exit protocol.